everybody's in.
Good afternoon, everybody. Thank you for joining us today. We have an exciting day here for Illinois Rare Action Network Rare Disease Day, virtual this year. Typically, we host these events at the state capitol and get together with folks there, but obviously due to the pandemic, we've gone virtual this year. So thank you for joining us today. I'm Kristen Angel. I'm the Associate Director of Advocacy at NORD. And we're going to kick things off with some two short videos, and then we'll go into the live discussion.
I am Tristan.
Angelina.
Nama saya Syafiq.
Regina.
Habari asubuhi, Havi.
Jeg Jon Christian og jeg bor I Norge.
I live in the United States of America.
In Australia.
Malaysia.
No Brasil.
Tunaishi Kenya.
My passion is for fashion and design.
I love to dance.
Menyusur hutan.
Para viajar e descobrir novas culturas.
Anapenda kunitazama nikipuliza mapovu.
Jeg elsker idrett og spille spill med familien min.
Minhas paixões são minha fuga quando as coisas estão difíceis.
Ada hari-harinya apabila melakukan perkara yang biasa akan jadi sangat susah.
When your disease makes you feel isolated.
It's difficult to walk. Å være med på laget.
When I'm tired.
Afraid.
O controle da doença pode ser desafiador.
Atau mengecewakan bila saya kehilangan masa.
Muda muhimu sana.
But we learned to be resilient.
Para apreciar os pequenos detalhes que me trazem alegria.
Kumwona mtoto wangu wa kiume anavyofurahi tunapoenda nje. Nikijua anasikiza hadithi na sauti zilizo karibu.
Mencari titik perhubungan dengan masyarakat yang tak pernah saya sedar wujud.
Å være uavhengig på grunn av menneskene rundt meg.
Their fierce support.
Sua bondade inabalável.
The big love. Mine venner.
Keluarga.
Enfermeiras.
Doctors.
Support workers.
Assistenter.
Mashirika ya wagonjwa.
Together we are a strong community.
Nimeweza kuelekewa.
Histórias compartilhadas que me libertaram das dúvidas.
Og ga meg selvtillit.
I am Tristan. I live with sickle cell.
I'm Angelina.
And she has CASC, a neurological disorder. Saya Syafiq dan saya hidup dengan ectodermal dysplasia.
Regina, eu tinha leiomiosarcoma, câncer raro.
Huyu ni Harvey, ana SMA, Spinal Muscular Atrophy.
Jon Christian og jeg har OI, medfødt benskjørhet.
Esta minha vida.
Suara saya.
And I am more than my disease.
We are rare.
Kami ramai.
Nós somos fortes.
And we are proud.
Okay. Allison, would you like me to launch? Oh, got it.
Yeah. Sorry, I minimized the tab on accident.
You're good.
Welcome. I'm Peter Saltonstall, President and CEO of the National Organization for Rare Disorders, and would like to welcome you to our 2021 Virtual Rare Disease Day event. But before we begin, I would like to send out a special thank you to all those advocates and others who have spent so much energy and time supporting the rare disease community. So thank you. The role of Rare Disease Day is to bring together advocates and patients from around the world to help tell the story about rare diseases. There are events like this happening virtually all over this country today. And some of the audiences that we're really trying to focus on are those in the state legislatures, where advocates and legislative people come together to understand the burden of rare diseases and the impacts it can have on them, and therefore build the appropriate legislation and pathway to make sure that bills are passed that support rare disease patients. As a matter of fact, NORD's doing that in a very focused way with rare disease advisory councils. We've got them set up down in 16 states and are building them in others. I think 2021 is going to be an interesting year for us. The reason I say that is because we've just come off of a very difficult year with a pandemic that's impacted the rare disease community in a number of different ways and has really shown some of the inequities in the healthcare system. For all of you that are watching today, the importance of the Rare Disease Advisory Councils is critical to the success of being able to communicate the story and the needs of the rare disease patient community. So in conclusion, I would really like to make sure that I recognize and thank all of those sponsors who have helped us make this day a reality. Without your continued support, none of this would happen. So a sincere thank you from all of us at NORD and the patient community. Taking part in events like today's are really important to the rare disease community, and we must always remember that alone we are rare, and together we are strong.
Great. I'm going to now pass the torch to our wonderful Illinois Rare Action Network volunteer ambassador, Maria. But I do first want to share with everybody, Maria has been our volunteer ambassador for quite a while now, and she's done amazing things with the Illinois Rare Action Network. You know, I will not take her spotlight away and let her share, but she's actually going to be stepping down from her role as our volunteer ambassador. And I just want to congratulate you, Maria, on the successes and everything you've done for the Illinois Rare Action Network program. You've been an amazing advocate. I know you'll continue to work with us in different capacities, and I know you've got a bright future ahead of you, and we wish you all the luck. But thank you so much for your time and your commitment to the rare community, to NORD, and to the Rare Action Network program. You know, it hasn't gone unnoticed, and we really are going to miss you. And somebody's got some big shoes to fill here in Illinois, but I'm confident we'll identify those individuals, and we'll continue the great work that you've been doing all along.
Thank you, Kristen. And thank you to everyone who is joining us for our Rare Disease Day event 2021. The virtual world has kind of become a new reality this year, and I'm glad that all of you have been able to participate if you've never been able to participate before. I have been in the Rare Action Network State Ambassador role for the last 3 to 4 years, and it has been a privilege to work with NORD. They're an amazing company, organization that supports our community. I couldn't thank them enough for the opportunities that I've had. And with that, if you aren't on the Rare Action Network or feel that you want your voice heard a little more with the organization, feel free to sign up for their newsletters and other programs throughout our state. Like many of you, I also have a rare disease. I have cystic fibrosis. It's a genetic lung disease. Today, we celebrate our unique stories. Alone, we are rare, but together we are strong. And this organization, as Peter stated, that we can change the way our individual states see rare disease communities through our councils. I also play a role on the Rare Disease Commission in the state of Illinois, so I will continue my advocacy for the rare disease community. At this time, our first presenter is going back to Kristen from NORD.
Great, thank you. Allison, I see you got, there we go. Sorry. Allison, I think I can share my slides right now. We're good.
Did I fix it?
Oh, I think, are you on? Sorry, I don't see a screen now.
Okay, mine clearly I don't think is working.
Okay, I think I can do it. Sorry, folks, I was having some Wi-Fi issues, so hopefully I won't. If I disappear, that's what happened, but we've got backups on the line, so bear with us a moment and I will get this presentation up. Oh, sorry. Okay, I think we're good now. So I'm going to talk a little bit more about the Rare Disease Advisory Council and our national initiative that we're working on here at NORD. The problem being that there's 25 to 30 million Americans living with one of the 7,000 rare diseases, in the country. And even though there's 1 in 10 Americans that have a rare disease, state policymakers are often have limited access or knowledge of what impacts the rare disease patients and family members in their communities and the overall healthcare system. We've also noticed over the recent years that many healthcare decisions are being made at the state level. So the solution is rare disease advisory councils. It's a diverse body representing the rare disease community to advise state government on their common obstacles. It's an opportunity for government officials and the rare disease community stakeholders to come together and develop resources necessary to help prevent and address barriers the rare disease community faces within their states. Currently, there's 16 states that have enacted Rare Disease Advisory Council legislation, and Illinois being one of them, as Maria just mentioned. It's the Illinois Rare Disease Commission. But as you can see from this map, those in the light blue currently have a Rare Disease Advisory Council in place. The orange are states that are currently working on proposed legislation or have proposed legislation in this year's sessions. And then the dark blue are states that we're still working on to develop coalitions to help get an RDAC in their state. So in December of 2020, NORD launched a Project RDAC initiative that we're going to be focusing on this year, and you'll be hearing a lot about. Project RDAC is actually a way to optimize existing rare disease advisory councils and help increase the numbers of rare disease advisory councils across the country. NORD acts as a liaison to help provide opportunities for all of the rare disease advisory councils to collaborate with one another, learn from each other, and share information that they have gained. We also have created educational resources and guides to help develop RDACs in specific states every step of the way, from first conversations to legislation to eventually launching the councils and getting them working. We've developed numerous webinars that we've hosted already, and we have many more coming down the pipeline. We have developed some toolkits and one-pagers revolving around the RDAC that we'll share in the chat box that you can visit and check them out for yourself. And I'm going to spend a little, I know Maria actually covered a lot of this, so I don't really have to go into too much, but yes, in 2016, the bill was passed for an Illinois Rare Disease Commission, and the purpose of the commission was to be responsible for recommendations to the General Assembly regarding prescription drugs, innovative therapies for children and adults with rare diseases, legislation that improve care and treatment for adults and children with rare diseases, screening of newborn children for the presence of genetic disorders, and compiling an annual report that includes a summary of the council's activity and recommendations. This bill is set to will sunset in 2023, sorry, not 2013. And you can learn more by visiting the Illinois Rare Diseases Commission website. I will also share that in the chat link as well. I'm also going to take a quick moment and talk about NORD State Policy Report Card that we publish each year. We just published our 6th edition of the State Policy Report Card, and this is the issues that are addressed in the policy report card. We know this is not a full comprehensive list of all the issues impacting the rare disease community, and these are the issues that are highlighted in this year's report. Medical nutrition, Medicaid financial eligibility, newborn screening, prescription drug cost sharing, and out-of-pocket costs, protecting patients in state Medicaid programs, as well as in-state regulated insurance, rare disease advisory councils, and step therapy are what we take a closer look at within this report. You can access the report card on our website, on the rarediseases.org website. And it is an interactive report card that you can navigate around and look in comparison to what other states are and compared to your state, and also pull up a printable version of your state's report card, and we will share that link as well. I do want to mention that the methodology, that these are actually snapshot in time. So this report card reflects as of November of 2020, with the exception of the Rare Disease Advisory Councils. That is through December 2020. Any current legislation that has recently passed or has is not reflected in this state report card and will be reflected in next year's. The appendices include detailed data, and each topic contains a methodology section as well. If you have questions regarding the state policy report card or the Project RDAC initiative that we've mentioned, please email the policy department at policy@rarediseases.org. Thank you very much. Maria?
Thank you, Kristen, for sharing our RDAC and state report card. I know it takes a community and a lot of work to get these report cards together. Our next presenter is Senator Sara Feigenholtz. She represents Illinois District 6. Maybe she's not.
Hi, everyone. This is Senator Feigenholtz as Chief of Staff. She's just running a minute behind and will be here shortly.
Sure. Maria, do you want to go to the other speaker and then we'll come back?
We can definitely do that. Our following presenter will be Cynthia. She's a CF patient, a transplant recipient, and an immigrant. Let her share her story.
All right. Hi, everyone. And thank you so much, Maria, for giving me the opportunity to share my story and raise awareness around not only cystic fibrosis or transplantation in general, but also around living with a rare disease. My story is a little unique in terms of I'm an immigrant who came to the state, and my life got saved here because of the doctors, my family, but also very importantly because of the Cystic Fibrosis Foundation and because of foundations like you guys that help and advocate for people like me. So I was born and raised with cystic fibrosis, and I was born in Beirut, Lebanon. Now, cystic fibrosis, I want to say, isn't commonly, I don't think it's not common in there. I just think it's not commonly diagnosed in there. And so I was just treated for asthma for probably 12 years of my life, although I had the most common, very brutal CF mutation. By the age of 12, I was extremely sick, and that's when they were able to diagnose me. I even had to go to friends to be able to get diagnosed. Now, even after that, I didn't receive the adequate treatment for cystic fibrosis. And when I was about 23 years old, well, I thought I was fine. I came here to the United States to visit my uncle, and when I was here, I had a very big collapse, sorry. And I went to the Cystic Fibrosis Foundation, and I was like, well, how can I get the new medication that's out there? They referred me to Northwestern, and that's when I was shocked to hear that my lungs were only at 22%, and I actually needed a transplantation as soon as possible. Basically, I never went back home, and I've been here for 4 years. I was able to, I had multiple fights to fight. First fight was, I need to get a transplantation. My second fight, I was an American citizen by then. And my last fight was, well, how can I stay here? If I go home, I'm gonna die there. There's no lung transplant in there. How can I stay here? And really, I worked with the CF Foundation. I worked also with Mike Quigley, who was a tremendous help in helping me stay here, advocating for me, working towards what can we do to help me stay here and save my life. And thankfully, 2 years later, I was able to get my life-saving double lung transplant, and now I'm doing much better. I'm living my life healthier, and that's all the work of organizations that advocate and help, and the work of legislators that not only are here to help the community and help the people, but understand the struggle and do not care where you come from, whether I was Lebanese or was coming from another country or not. They looked at me as a person who needed help, who lives with a rare disease, and they helped me. And I'm a living proof of it works, and I'm doing much better, and I'm living my life. I'm not on oxygen anymore. I'm working a full-time job. I'm walking, I'm running. All of these things were very, very, very hard for me to do. Now, coming from another country where I know you don't have someone that raise awareness, you don't have organization that will stand with you, hold your hand, fight for you. I really see the value in it. And not only do I see the value in it, I appreciate it so much. And that's when I made it kind of my mission to raise awareness, help people like me get a chance at life by raising awareness, talking to legislators, all of that, because it does work. And one thing that I keep saying is it takes a village to beat cystic fibrosis, and I'm sure it takes a village to beat every other disease. You're not alone. Organization like NORD, organization like the Cystic Fibrosis Foundation really are here to show us you're not alone. We're fighting against you, with you, not against you, sorry. We're fighting with you, we're fighting alongside. And that gives us that gives us hope, right? That gives us hope that it will get better, and it does. So, sorry, I lost my camera. So I want to say thank you so much for NORD. Thank you so much for standing with us. Thank you so much for fighting along with us. And yeah.
Thank you, Cynthia, for sharing your story. You do have a very unique story. I'm glad you had the chance to join us today to share that with us. And you've come a long way. I've known you all the 4 years you've been here, and it's a very inspiring story. It does give hope that talking to our legislators are able to, you've seen the outcomes of speaking to them and getting your voice heard. And with that, I'd like to present Senator Sara Feigenholtz. She is an amazing senator. I had the pleasure of meeting her last year, right before Rare Disease Day, and she advocates for the community just as much as we do. She represents Illinois District 6. Please welcome Senator Sara Feigenholtz.
Thank you, Maria, and thank you, Cynthia, and thank you, NORD, and the amazing staff, not just for the work you do, but how difficult it is to share your personal stories, because you're reliving a lot of trauma that you went through, not knowing anyone was going to recognize, respect, and understand what you were going through and whether you would ever make it out alive. But I have to tell you, Cynthia, the value of telling stories to legislators, there's really not quite anything like it, because being able to hear what goes on in the everyday lives and in the everyday healthcare challenges that our constituents are facing is exactly what drives the legislative process. That is how the founding fathers designed it. And so telling stories are very powerful. People listen, and it creates a great deal of understanding and empathy that many of us, myself included, weren't that conscious of. When I met with a lot of folks who are down in Springfield, Maria can attest to this, last year, and actually, I don't even know when it was, because we've been home for so long. I think it was in 2019. Was it in 2019, Maria? Do you remember?
It was 2020, right before the world shut down.
Yeah, it was, we all were sort of talking, and there were a lot of people who had similar stories to Cynthia's. And it was very eye-opening for me to have a deep understanding of what goes on in the life of a person with a rare disease. And I know that we passed a law establishing a rare disease commission. What year was that?
17.
2017. And was it a standalone piece of legislation?
Yes, it was.
Okay. And also what we did was when we sort of reconfigured the medical advisory committee at Medicaid, which sort of takes a look at emerging drugs that are coming onto the market that are FDA approved, but not quite yet in a formulary, should we say, that we included rare diseases in that MAC committee so that they had a seat at the table to talk about emerging pharmaceuticals and remedies that will help treat some of these rare diseases. So, I mean, we have got to go full circle on this because this is a growing constituency of people who have very unique needs. And that's what the legislature is here for, honestly. Coming down to Springfield or making appointments to have a Zoom meeting with a legislator, especially those that are on the healthcare committee, people who are on Medicaid and insurance committees, or anything having to do with access for people living with rare diseases is a key piece of the value of NORD, and everybody should hear your stories and take the time to meet with people who are living through this. So Cynthia, get ready. You got a lot more visits to do.
Oh, I would love that. And truly, I do think, and I do encourage everyone to share their story. I mean, growing up, I was very secretive about it. And I was like, I was so secretive about it that I didn't know a lot of people that had CF. And I thought it was just me, right? And sharing my story more and more and getting the courage to talk about it had made me feel better and giving me more, empowerment, but had helped people around me see and hear what I go through. I mean, CF is an invisible disease. If you look at me, you'll think I'm totally fine. No one would know I have a deadly disease that I struggle with every single day. So definitely share your story as much as you can. And you will be surprised by the amount of compassion and the amount of, people will love to help, and they will help in any way that they can. So yeah, definitely share your story. I know we are rare, but just like my boyfriend liked to call me, we're just unicorns, and we need to share our stories.
I love it. That's a great way of putting it. There's a lot of unicorns out there. We love unicorns. So I'm just delighted to be here, and thank you for asking me to be here to talk about this and what we do in the legislature. But, having a voice is very, very important. This is not legislatures are waiting to hear from you. You should definitely, just like, the NORD folks and came down to Springfield, you should continue, once the doors are open and safe, to have a presence down there to fight for what you rightly deserve.
Thank you so much, Senator Feigenholtz. Your words do mean a lot to our community, because I know there's a lot of people on this call that feel talking to their legislators won't get anywhere. I know when I began, volunteering, it took a lot of encouragement to make that first step. But once you make that first step, it gets easier and easier. We're not telling you to do anything different from your job. You're just telling your story. And with you being here, being a presence with NORD, thank you for taking the time out of your busy schedule to be here. And like I said, it was a pleasure meeting you last year, and we will definitely be in touch. And I hope to be in Springfield sooner than later.
Well, make sure I know you're coming, Maria, or any of your clan. You want to meet my cat? And I'm sorry, I can't lock them out. They'll just make me. So it's really been great to have this chance, and I really miss FaceTime in Springfield with all of the wonderful people who, every day is a new day in Springfield. We have incredible opportunity as legislators to learn about so many things, and to keep our minds and our hearts open, and to remember that our charge as legislators is to help our constituents so that they believe in government and be authentic and empathetic. Those are things that I think you're going to see a lot more of from the new House and the new Senate. I'm very excited to be in the upper chamber and have a sort of an experience from a different perch with some really wonderful senators from very diverse group of senators who so far have done some pretty amazing things. So in a very short while from a long distance. So, you know, rare disease folks should definitely get online and figure out who their House members and Senate members are and talk about their agenda. Sometimes it's just nice to say, I want you to know that I'm part of an action network about rare diseases. I'm not going to talk about details now, but I would love to come into your office one day in the summer when you have more time and get to know you and share some of what my life experiences are that I'm sure are not unique. I am sure I'm not the only person in your district that has a rare disease, because that's how it works. So Cynthia, I'm going to call you and I'm going to follow up and make sure you're doing that. I don't know whose district you live in, but this is how advocacy works. The squeaky wheel theory.
Yes, please do. I would love that. And thank you so much for all the work you do. I mean, it really, really, really means a lot. And it's because of people like you that we feel more and more encouraged to share our story, because not only do you hear us, do you feel what we feel, what we go through, but you're willing to help us. So this is amazing. And thank you so much.
Well, Cynthia, I have to tell you that I grew up in the home of a physician. My mother was a doctor, and I watched her take unbelievable care of her patients. And I believe that there is you know, that this is a very strong relationship between doctor and patient, and that if we have to be the conduit by giving doctors a little bit more perspective on what we're hearing, that's what we're here for. But I'm honestly very, very blessed to help people. I'm blessed to have the station in life where I can actually do it, and I don't take it for granted.
Thank you so much.
God bless all of you. I had 2 Zooms right before this. I'm sorry I was late. I had some technical difficulties with no audio, but I just want to say thanks for inviting me to do this. It really means a lot to be at the table here with all of you.
Thank you again. And if it's all right with you, Senator, I'll share your information, your email address, and how they can reach you at your office as well.
Please
and I will make sure that you have Cynthia's and any other speaker who would like to reach out to you, their information as well.
Terrific. Thank you again, and have a great weekend, and God bless all of you.
God bless you as well. Thank you. And with that, I'm going to turn it over to our next speaker, Stacey Feuer, which is a rare disease patient and a health psychology, works in the health psychology department.
Hi, everyone. My name is Dr. Stacey Feuer. I am a clinical health psychologist and rare disease patient. So I'm going to be talking today from a little bit of both perspectives. I'm going to talk a little bit about my story, and also as a clinician working with adults with chronic medical illness and rare disease diagnoses as well. But first, I really want to say thank you to Maria, not just for today, but truly for all of your work in the past few years. I want to thank Carrie, Lotto, and Nord for organizing this event, and Nord, of course, for all of your support. And thanks to everybody for taking the time to be here today and to participate, and especially, although I know she signed off, to the Senator for taking her time today. Next slide. Okay, so we don't have a lot of time today, so I'm going to give you the brief story for myself. So I was diagnosed with a rare genetic disease called Gaucher disease, type 1, in 1997 when I was 20 years old. And some of these numbers will, I think, give at least a general picture of this 23-year journey that I've been on so far. So in those 23 years, I had 18 years of biweekly infusions at an approximate cost of about $4.5 million and 468 infusions. I've also been on oral medication for the last 5 years instead of those infusions, which are also quite costly. And although it may not seem clear by looking at me today, I had about a decade of significant disability in my 20s because of my illness, and have been very fortunate to see that change over the years. But I spent about 10 years unable to walk, unable to work, and unable to live independently and support myself. So it was a very difficult time, and it completely changed the course of my life. So looking back on that time, you know, some of the things that went really well were that I was very lucky, especially in the rare disease community, to be directed to the right specialist and the Gaucher disease community pretty quickly, which made all the difference in the world for me. I had really good insurance. I had a strong support system, and other advantages like being educated and Caucasian were really helpful in getting the things that I needed. There were, however, opportunities for better outcomes, lots of opportunities, but two that really stand out are the fact that if I had been diagnosed earlier, if somebody had recognized my rare disease when I was younger and I had been put on treatment earlier, I probably would not have lost those 10 years of my life. Or been derailed, shall we say, for those 10 years. And if I had had different insurance, which is something that I think is always on issue here with rare disease patients and our costly treatments, I would have also had exceedingly more difficulties gaining access to medical care because my insurance didn't require referrals for every single visit, amongst other advantages that it provided. And for myself, one of the biggest issues that I dealt with as a patient was how difficult and isolating, depressing and anxiety filled those experiences were for me, and how difficult it was to connect with people outside of my community, Gaucher disease community, who would be able to help with that. And so it really inspired me when my health did fortunately improve to go out and to help other people who were living through that situation in a way that was not available to me. And so when we think about rare disease patients, you know, as a patient and also a clinician, we see that there are issues that affect the community as a whole. And one of the standout issues is delays in diagnosis. We know that an average rare disease diagnosis takes about 8 to 10 years. I'm sorry, next slide. We also know that misdiagnosis is a huge issue with rare disease patients. So somewhere around 40 to 60% of rare disease patients receive at least 2 to 3 misdiagnoses in their journey. For myself, I was misdiagnosed with everything from anemia as a teenager before I was really sick, and leukemia when I was in the process of being diagnosed, which is a common misdiagnosis for Gaucher disease. I was even told at one point that I had a staph infection in my knee and would have to have that leg amputated. So misdiagnosis can be very traumatic and stressful, and unfortunately is a big part of this journey. And rare disease patients are about 2 to 5 times more likely to be misdiagnosed than other patients with better known diseases. Rare disease patients often face a lack of treatment options due to lack of knowledge and the expense of research, extremely high medical costs which are often more stressful to deal with than the illnesses themselves. My treatments, for example, cost about $250,000 per year, and limited access to specialists who understand their disease. Next slide. And so when we look at how these issues affect patients' lives, rare disease patients' lives, we see that it impacts their medical outcomes as well as their economic outcomes. Recently, the Rare Economic Burden Study was released just this month, and it estimated that the economic burden of rare diseases in 2019 was about $1 trillion. And for individual people, it often is the main stress and source of stress in their life, being unable to deal with the medical costs that these treatments and this amount and level of care comes with. Because of that, there's a decreased ability for financial independence, ability to work, and many people report depression and anxiety. And just to give you an idea, some studies have shown that rare disease patients report moderate to severe depression, something like 6 to 8 times more frequently than even people with other illnesses like cancer, and about 3 to 4 times the amount of anxiety. And so rare disease diagnoses come with a increased mental health burden that really impacts our lives. I was glad to hear the senator mention the word trauma, because we do experience trauma through either our illness experiences or the increased contact that we have with the medical system. And so trauma can be ongoing and chronic, just like our illnesses. Isolation, difficulty finding peer support, and decreased quality of life, which is more significant than either, again, some common illnesses like cancer. And I can tell you that I experienced all of these over the years, and these are very real, and they impact our lives very, very much so. Next slide. Okay, and so what does that all mean? And how can we address those things? As a rare disease patient, I can tell you that things that seem procedural, like having good insurance, completely change the quality of our life. And things like annual or lifetime caps, or the ability to have copay assistance. There was a time when those things were not available to us. And for example, with myself, until those things changed, there was very little hope that I would be able to go out and be independent and live my own life. And when those things changed, it allowed me to now, 23 years later, be doing the work that I do and helping other people. So these changes change our lives. And so the last thing I just want to say today is I recently ran across this meme that said, instead of saying I have to, say I get to. Today I get to, instead of today I have to. And while I'm not a big fan of oversimplified memes, this one really struck me. And when I was thinking about this event today, and thinking about the rare disease advisory councils and the types of laws and regulations that really change our lives, it struck me that because somebody did this work 10, 15, 20 years ago, my life was completely impacted. And today I get to do things that 10 years ago, I couldn't even get out of bed. I needed a wheelchair in order to get around. I was bedbound. But today I get to help other people. Today I get to participate in this conference. And when I think about the Rare Disease Advisory Council, I see it as an opportunity for Illinois and our legislators to provide that for people today, so that more rare disease patients can say, today I get to do something that I wasn't able to do yesterday. So thank you so much for inviting me today, and thank you for this opportunity.
Thank you, Stacey. That was a very powerful statement. I've never looked at it that way, even with my positive outlook that I try to have with having a rare disease. So thank you again for sharing your story and your input on how you think the councils would help, and talking to our legislators would help as well. We really appreciate your time. I would like to introduce our next provider perspective, which is Dr. Carolyn Jones.
Hi guys, my name is Carolyn Jones. I am a clinical geneticist at Rush University Medical Center. It's actually in Chicago, but occasionally I work at Oak Park. Next slide. Next slide. Okay, great. So I'm going to be talking about the purpose of newborn screening and the implications for newborns. And before I get started, I'd like to say there's nothing more cost effective in all of medicine, especially in public health, than newborn screening. And there are two main objects: is prevention of illness and to anticipate potential problems. As a geneticist, I always say probably 1,000,000 times a day, knowledge is power. What I can anticipate, I can try to stay, a step ahead of. Next slide. So I want to talk about what the principles of newborn screening are. And this is called the Wilson-Junger criteria. And these were made a long time ago, but I want to emphasize that times have changed. And so we use the same criteria, but that has added additional disorders. So the disorder has a significant health problem. Okay, that's a lot of things. The disorder can be tested for. We started newborn screening in like the 1960s, and we started with a rare metabolic disease known as phenylketonuria, or PKU. And it wasn't actually easy to test. We actually have easier ways to do it now. But the next thing, which is a much higher bar to get over, is the disorder can be treated. So nowadays, with sequencing and things like that, I can test for almost anything, but can I treat it? When I see families, I'll say, we have 22,000 genes. We know of maybe what 1,000 or 2,000 do, and we can do something about maybe 20, unfortunately, that bar, but every day is a new day. And then the next thing for newborn screening is optimal outcome occurs if it's diagnosed early. So if it doesn't matter if you're diagnosed at 2 weeks or 20 years, then there's no purpose in it being in the newborn screen. I would just like to also emphasize, every state has things a little bit different, and both of the things that were talked about today, both cystic fibrosis and a lot of the lysosomal storage diseases, are on our newborn screen, and they're not on every state. So that's kudos to Illinois. Minimize the number of individuals affected who are not picked up by the newborn screen. So unfortunately, I can't control math, but when you minimize false negatives, you actually maximize false positives. And that's unfortunately just the way life is. Next slide. So this is actually a recommendation panel by the Department of Health and Human Services, so more of a national kind of recommendation. And they kind of give the states, ideas of what kind of disorders that they may choose. You can always choose what you want, but this kind of gives a list. So one is, and similar to the last slide, a net benefit to screening. So it does some good. The next is public health readiness to screen. And not all states have the same readiness. And the next is availability for treatment. So if the treatment that you're talking about is a bone marrow transplant, and you're in a state that doesn't have a children's hospital with the ability to do that, your state, that might not, make sense. We're fortunate in Illinois, we have a number of very large children's hospitals that can handle these situations. But the RUSP is like an established standard of approved disorders, and every state kind of chooses what they want. Just going back to lysosomal storage, I was at a meeting a couple weeks ago, and Illinois does more lysosomal screening than pretty much any other state. So I was very proud, and it was very exciting because, the more kids we find, the earlier we find them, the better off it is. And there are some disorders that actually are mandated by the state, and there are some disorders in Illinois. Basically, family advocates go to the state legislature and advocate for those disorders. They may or may not fit into the other criteria that we've talked about, but that's another way for the state to have something on their particular panel. Next slide. So this to me is the exciting part. Outcomes of infants diagnosed through newborn screening. The first is 92% of infants diagnosed with a disorder by newborn screening are asymptomatic at 13.5 months. Lower percentage of hospitalizations in the first 6 months of life, 28% if they're diagnosed through newborn screening versus 55% if they're diagnosed through symptoms. And as our speakers have talked about, these symptoms, you go through quite a long medical odyssey. So these babies often go through quite a medical odyssey before they get to that. And then developmental quotients are 15 points higher in infants diagnosed through newborn screening as compared to diagnosed by symptoms. 15 points is the difference between having normal cognition and needing an IEP, needing special help for the rest of their lives. And this primarily is probably PKU and low thyroid, but a lot of these disorders result in neurologic issues if not identified early. Next slide. So false positives. 1 in 12 babies have an abnormal newborn screen. And again, it's because we're trying to minimize false negatives, but only 1 in 50 actually have the disorder. This is a very difficult thing when a pediatrician has to call a mom and dad who haven't slept in days because they have a brand new baby that cries all night. If anybody's had a baby and they're exhausted and they tell that, and they all come out, just so you know, they all come off the copy machine at 4:30 on Friday afternoon. You know, this newborn screen, which the family may or may not have even recalled that the baby got, there's something abnormal. And the minute you hear abnormal, it's devastating. And some of these disorders, we actually have to change the diet, which means stop breastfeeding, which is very stressful, or, you know, feed the baby every three hours. And I've had families that still think that that child has that disorder like 10 years later. We rule it out. It's a screening test. It's not diagnostic. We rule it out. And 10 years later, they come to see me for something completely different. And they're like, I think my baby had, you know, my baby had an abnormal newborn screen. So it's so important for us as physicians, not only to contact the family and make sure they do or don't have this disorder, but make sure that they understand if they don't, that they don't have this. Fortunately, most babies with an abnormal newborn screen come from the neonatal intensive care unit. And most of that is because they have anemia, because we stick them all the time and draw blood. Their liver's immature. They're on special IV fluids that give amino acids. There's like lots of reasons. And the NICU babies get these newborn screens at 24 to 48 hours, 2 weeks, 4 weeks. So what's great about a NICU baby is I know where they are. They're in bed 6. I know what their heart rate is. They're attached to a monitor. They're not going to stop breathing. I don't have to worry about them. So we don't usually panic about that too much. We just repeat it. And I only worry about it if the same thing is abnormal twice. So if the first thing is abnormal for A, and the second one's abnormal for B, and the third one's abnormal for C, we mention it to the parents, but they have so many other things on their plate. That's like not a concern of ours. Like we only worry about it if we get the same thing twice. Next slide. So the last few minutes, I want to talk about new disorders added based on new therapies. And next slide. I'm not going to go into a lot of detail of this disorder, but spinal muscular atrophy is a rare disorder occurring in about 1 in 10,000 babies, which is similar to the frequency of phenylketonuria. But as everyone has talked about, rare disorders, when you start adding them up, they're not so rare. Clinical features include having symptoms around 6 to 8 weeks of low muscle tone, but that can occur from even before the baby's born to sometimes even adulthood. And it's caused by loss of what's called the anterior horn cells. So when we want to move our hand, our brain tells our nerves, tells our muscles to move. The connection between the nerves and the muscles get destroyed. And so the muscles don't get that signal to move. So they kind of atrophy and wither away. we've been able to test for spinal muscular atrophy for over 10 years. And if you came to me 5 years ago and said, I think we should test for SMA on the newborn screen, I'd say, but what are you going to do about it? So that's, you know, just because you can test for it, what are you going to do about it? 2 or 3 years ago, the FDA approved a new medication. And the outcome of kids with SMA is horrible. 25% die by 9 months, 75% by 13 months. But this new medication, if started early, results in children with normal gross motor and fine motor development. It prevents the destruction of these neurons. The muscles continue to get innervated. And so this medication that was just approved like 2 years ago has changed the outcome of kids with SMA to such an amazing, it's like amazing to see these kids walk and do normal things when they would otherwise be in a wheelchair or on a ventilator. So this is, to me, such a great example of how things change, and you know, then these disorders fit into the newborn screening. Illinois started, even in the middle of the pandemic, screening for SMA last July. So, you know, kudos to Illinois, because they've started this and they're going to save babies from a rare disease. And yeah, it's probably an expensive therapy. I know it's an expensive therapy, but what's more expensive, having a baby on a ventilator, having a baby in a wheelchair, having an individual never be able to achieve anything? I would just argue, I don't know that that saves money. Next slide. So these are just some resources for newborn screening. One is the Babies First, and the second is the American College of Medical Genetics has these great act sheets that will tell the pediatrician, like, if it's abnormal for whatever it is, what do you do? You know, some of them you have to change a formula, some, you know, you just repeat it again, and where to go, and, you know, the things to do. And so next slide. So to conclude, each year, more than 700 babies are diagnosed with disorders through newborn screening. A lot more have abnormal newborn screens, but these are the ones that are positive, okay? Outcomes of children diagnosed through disorders for newborn screening compared to symptoms are so much improved. New disorders are being added all the time based on the criteria that I was talking about and based on these new medications that are available. The Rare Disease Advisory is important in this because it helps, you know, keeping on top of this, and as science is changing, adding new things to the newborn screening. And again, I just like to say, Illinois, I'm proud to, you know, work and live in Illinois because we've done more than a lot of other states around us. So today, every state has a different group of things. Newborn screening is the most cost-effective way to detect a variety of disorders. An improved outcome has been shown with early identification of these disorders. So like Gaucher's, we diagnose it on the newborn screen. We might not even start that kid till they're 5, but they don't go through a medical odyssey. So that concludes my presentation. Any questions?
Thank you, Dr. Carolyn Jones. We really appreciate your time and expertise, especially sharing how the newborn screening affects the rare disease community and what we can do to hopefully see more things added to our to the RUSP in Illinois. I want to thank everyone who's spoke today and shared their stories. Like the senator said earlier, it is hard to share your story in the beginning, but everyone wants to hear it, as everyone's story is different. This event is going to be concluded with a video, but prior to the video, I'd like to announce that we're going to have a swag bag door prize that will be raffled off randomly, selecting 2 attendees from today's event. Winners will be contacted via email this week, and your prize should arrive mid-March. So thank you and good luck. And for any questions or concerns, you can bring them to Nord. You can contact me or Kristen as well. And if you are not on the Rare Action Network or want to learn more about it, join us at www.rareillinois.org.
Great. Thank you, Maria. And again, thank you for your service and commitment to the Illinois Rare Action Network. We're going to miss you. This is officially your last event, officially. Unofficially, we know we're going to keep you around. So thank you again. And we're going to close out with this brief video. Thank you all for joining us today. We hope you enjoyed the program, and we hope you continue to work with the Illinois Rare Action Network and NORD throughout the year as we develop more programs and services. And keep an eye out for future events.
Every year on the last day of February, the National Organization for Rare Disorders joins together with others around the world to raise awareness of the challenges faced by people living with rare diseases. Achieving health equity is even more difficult for rare patients. To have equity in health means everyone has an opportunity to be as healthy as possible, regardless of social, geographic, economic, or other obstacles that may be working against them. At NORD, we appreciate your support, which allows us to work on issues like health equity and many others, and for our staff and volunteers to bring them to the forefront on Rare Disease Day.
From the volunteer state ambassadors, we would like to say thank you to all of our Rare Action Network supporters for helping us connect with rare patients and families in our state.
And thank you for allowing the Rare Action Network to raise important issues with state lawmakers on Rare Disease Day and throughout the year.
Did you know that in medical school I was told when you hear hoofbeats, think horses, not zebras? But what about the more than 25 million Americans living with a rare disease? At NORD, we are humbled to provide help and resources to our zebras and their caregivers.
NORD support allowed me to catch up on some overdue bills, including my rent. Thank you for your support, NORD, and thank you for supporting Rare Disease Day.
From all of us at NORD, thank you for your dedication to the rare disease community on Rare Disease Day and every day.
Okay, thank you everyone for joining. I hope you have a great rest of your day, and be sure to tune in online on Sunday for February 28th, Rare Disease Day worldwide. There'll be a lot of activity happening. Follow the hashtags Show Your Stripes and hashtag Rare Disease Day to follow along on Sunday. Thank you.